Hello, everyone. Welcome. We are really excited that you're joining us for Acera's 2023 Virtual Health Fair. I am Mike Farah, Acera's Communications Manager, and I'm joined today by Ish Pina, Assistant Benefits Manager for Acera. And I just wanted to say that it is so nice that we can all come together in this forum for the fourth year in a row. We are delighted that we can continue to reach out to a broader audience outside the Bay Area with this virtual event. So I'll be your moderator today. But first, to say a few introductory words, I would like to introduce Acera's Assistant CEO over Benefits, Carlos Barrios. Carlos, are you there?
Thanks, Mike. So first, I want to thank you all for joining us for Acera's Health Fair today. Your presence and engagement make this a really special event every year, and we appreciate your support and participation. Second, I'd like to introduce myself again. I am Carlos Barrios. I am the Assistant Chief Executive Officer over the Benefits Department here at Acera. Now, joining us today are 5 presenters from Kaiser Permanente, Delta Dental, VSP, Via Benefits, and United Healthcare. Each presenter will have 45 minutes, including some time for questions at the end. If you have questions for a presenter, press the Q&A button on your Zoom control panel, and then type your question into the Q&A feature. You can type in your questions at any time, but we'll answer the questions we have time for at the end of each presentation. We won't be using the raise hands feature today. We are recording all of today's presentations, and those will be available on the Health Fair website early next week, so you can revisit the presentations as much as you like. That page is acera.org/healthfair. The schedule for today is at the top of the web page, and you'll see additional materials provided by each presenter, as well as a virtual expo hall of other vendors further down the page who have provided information and freebies. We'll leave the virtual health fair page up during open enrollment so you can take advantage of it later on if you like. One last thing, after today's event ends, we're going to hold a drawing for 7 raffle prizes. Only all of you who are present in this Zoom live event will be entered to win. And we'll contact you via email if you've won a prize. Again, thank you all for joining us. And I'll turn it back over to you, Mike.
All right. Thanks so much, Carlos. So let's get right to it. For our first presenter, I am so happy to introduce Kevin Pham from Kaiser Permanente. Kevin is a personal trainer and yoga instructor with Kaiser Permanente Corporate Health and Wellness. Hey, Kevin, how's it going?
Hi, Mike. I'm doing well. Can you hear me?
Yep, we can hear you.
Okay,
Thank you so much for being here. Go ahead and feel free to share your screen.
Okay, sounds good. So everyone, good afternoon. Just like what Mike mentioned, my name is Kevin Pham. I'm a personal trainer with Kaiser Permanente. A little bit more about myself. I have a bachelor's, a master's in exercise science. I'm a strength and conditioning coach, certified personal trainer, exercise physiologist, and a yoga instructor. So yes, lots of certifications. A little bit more about myself. I didn't know how important it was to take care of my back. And I actually had a herniated disc when I was 21. So I was trying to lift really heavy weight, and I lifted with a rounded spine, and I heard a pop, and the pop was louder than like the music in my headphones. And I stood up, and I was like, oh my gosh, what happened? And like my back seized up, and I couldn't even bend over. I couldn't even squat down, and it was like one of the worst pains of my life. I had sciatica at the age of 21 running down the left side of my body. And since then, I've been dealing with back issues. It's gotten better, but it's gotten better through yoga and stretching, which is what I'm certified under. So a lot of times we're not really mindful of taking care of our back. I think if we ask like a quick show of hands, I think most of us have experienced some kind of back pain, hip pain, shoulder pain. It's one of those big things that the more we can take care of our back, the more we can take care of our bodies, we're going to feel so much better. There's a saying in yoga that we're as young as our spine. So we want to make sure that we take care of our spine, we keep it limber, and we try to exercise and stretch so that we can feel so much better. So with today's presentation, we're going to talk a little bit about anatomy of the back. We're going to talk about how to prevent these back issues from occurring. From there, we'll transition into actual exercise. So we're going to get up, we're going to move. Keep in mind, these exercises are all body weight. And then I'm also going to send out a handout afterwards where we'll have all the exercises that we worked on. We'll do a quick maintenance in which we'll talk about how we can create a plan to maintain exercise, to maintain a healthy back. And then finally, we'll close with a Q&A. So keep in mind, just like what the other presenter said, we're going to leave the questions towards the end. So if you have any questions, just type it in and I'll try to answer it as much as possible. Now, I want you to think about, you don't have to type this in. Why is it important for you to take care of your back? I just want you to think about that. Why is it important? Now, personally for me, one of the big things is I want to
Are you
live
still
a
there,
life.
Kevin?
Yeah. Can you hear me, Mike?
Okay. Yeah, it looked like
Yeah.
you had frozen for a second.
Oh, no worries. I'm still here. Everyone, one of the big things like I asked for is why is it important for you to take care of your back? For me, at least, I wanted to live a life that was pain-free. I didn't want to have any back issues. I didn't want to have any pain, sciatica running down the left side of my body. I wanted to be able to do all the things I love. I have 2 dogs. I walk them every day. I try to exercise and stretch. I want to feel like I want to live a life that I don't have to have any pain and have lots of independence. Something like what you're thinking about, whether it's driving, walking, going grocery shopping, even just using the restroom, picking something up above the shelf, just having independence, as you get older is so, 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 so important. Next thing is we'll transition into talking about the anatomy of the back, right? So you have the spinal cord, which is going through the vertebrae, which is the bone. You have the ligaments that are holding everything together. You have the disc, which is what's cushioning each vertebrae. And when you hear about a herniated disc, that's when the disc slides out and it hits the nerve in the back. That numbing, throbbing feeling that you feel sometimes can be from a disc sliding out. It can be from the muscles being really tight, everything really being really stiff and tense. And that's why we want to stretch and move and stay mobile, is that the more often you can stretch and move, you're going to keep your muscles nice and limber, and you're not going to have that potential pain from having the disc slide out, having the muscles super tight. So next thing is, what are you doing to take care of your back? I want you to think about that. What are you currently doing? Personally, for me, like I said, I do a lot of yoga, I do a lot of stretching. I actually used to try to power lift, which is lifting really heavy, really, really heavy weight. And what I didn't realize is that when you lift really heavy weight and you're doing a lot of impact activities, your spine gets smaller. So it's a compression force. So if you're lifting a lot of weight, or if you're doing a lot of running, or if your posture isn't really good, your spine compresses and you get shorter. So personally for me, I try to do a lot of stretching on a daily basis just because I know the more I can stretch, the better I feel. Stretching also releases endorphins, so you actually feel really good. I also do something called foam rolling, which is stretching and massaging your hips and your lower back and your shoulders. So personally for me, I know that the more I can take care of my spine, the more I can exercise, and even doing things like walking. You're stretching out your back muscles by taking steps, and you're standing up tall. Doing things such as swimming, water aerobics, Pilates, doing any type of exercise that moves your spine, moves your hips, that's the best advice that I would give you so that you can prevent these back issues from occurring. So going into more of the back basics, we know the benefits of having a healthy back. We're independent, we're living this independent life. We don't really need anyone else. We don't need to take pain medication. We're not hunched over. Independence is very important. As I said before, everyone, if you haven't had a back injury, that's very good. But most of us have had back injuries, have had an injury before, and living in pain is a very, very uncomfortable feeling. So just know being pain-free is so, so, so important. Next thing is that as we get older, I feel like we want to be independent. We want to do the things that we want to do. We want to go for a walk. We want to play with our grandkids. As much as possible, we want to make sure that we maintain or increase physical activity, because just as we get older, we get more sedentary and we don't spend that much time exercising. with risk factors, and I'm going to go over this a little bit more later, but poor posture, slouching, overexertion, maybe exercising too much, or maybe doing too much weight. Repetitive motion, I know everyone knows what this is, but, we're literally doing this all the time. It's not a very good posture to be in. Being inactive, some people think retirement is, sitting on the couch and watching TV, or, or just sitting and being in bed. As much as possible, you want to get up and moving. And as we get older, the fascia, the muscle connective tissue in your spine, it gets more tight and tense. I remember when I was 18, I could play basketball. I could pull an all-nighter. I could exercise for 3 hours. The next day I wouldn't be sore. If I did that today, oh my gosh, my back would hurt, my shoulders would hurt. But as you get older, your muscles just aren't as limber. We're not as flexible as we were before. So it's so important that as we get older, we maintain physical activity and exercise. Next thing is, how can we improve? Just being aware, what is proper posture? Also maintaining healthy weight. If you're carrying a lot of weight with you, you tend to slouch forward like this. It's not very good for your back. Very important that we can stretch your body and strengthen your muscles too, which we'll do in the activity in the next couple minutes. Next thing, everyone, so even with the back basics like we talked about, with the prevention aspect of it, we'll talk about posture, we'll talk about safety, we'll talk about muscle strength and flexibility. We'll go through the exercises, as I said before, we'll get up and move. And finally, with the maintenance aspect of it, just want to make sure that we set a goal and then we try to practice regular exercise. So looking at this picture, it's pretty amazing to see that the person on the left versus the person on the right, they're the same person, but then you have incorrect posture and you have correct posture. So a slouching movement is very similar to this. An upright position is this right here. So what is an upright position? You want to think about being lifted. So whether you're standing or sitting, sucked in your stomach, keep your chest lifted, chin up, chest up, and try to sit up as tall as you can. And I'm sure you probably all noticed that you sat up maybe another 2-3 inches. Really big thing is that you keep your chin up instead of looking down. You create a lot of tension when you do something like this. You want to engage your abdominals and then shift the weight to your sit bones. Also with your feet, if you're sitting down, push your heels into the ground, sit up tall, and you'll notice you feel stronger and you're more in an upright position. So as much as possible, if you're standing, if you're sitting, ears, shoulders, hips, if you're standing, knees and ankles in one straight line. So that's alignment. When you think about your spine, it's almost like a Jenga block. So the more we move the Jenga blocks out to the side, the foundation gets compromised and it has a capacity to tilt, fall, and that's basically an injury. So as much as possible, keep those Jenga blocks in a straight line. With posture, everyone, as I said before, is so easy to look down and do something like this. As you see, everyone, this position's a rounded position, and as much as possible, you want to get out of that rounded position. If you're on a laptop right now, please put it on a table as opposed to your lap, because a laptop is so easy to do this position, and this position's a rounded position. If you notice, this position is very similar to a position in a walker, because people in walkers, they don't hold it close to them. They hold it further away from them. Then they start rounding like this and they start hunching forward. So as much as possible, you want to pull your shoulder blades back and try to be aware of where you are in terms of, are you sitting in an upright position? Are you standing in an upright position? When you're doing yard work, is your stomach sucked in? Is your chest lifted? And are you leaning forward or hunching forward like this? So you just want to make sure that everything that you do, you maintain a proper position, because what happens is that the muscles in your back get tight. They don't have flexibility, they don't bend, and then they just stay like that, unfortunately. Next thing is, if you are at a computer, there's a science called ergonomics, which isn't adjusting your body to the computer, it's adjusting the computer to your body. So what does ergonomic mean? It means that same thing, straight line, arms are relaxed. You're not shrugging your shoulder up to type. Your shoulders are shrugged down. You're looking straight ahead instead of looking down at the monitor. So there's a lot of different resources. If you just Google ergonomic resources, I can also send some things too. But this is a position that you want to be in if you're at the computer. A lot of us, when we tend to work, we think we can lean forward and type harder and work faster. But this position, same thing, position as a walker. So as much as possible, sitting up tall. And these are just basic guidelines on how you can maintain proper position, proper alignment when you're working and sitting at a computer. Now, there is a saying, and some doctors at Kaiser Permanente have said it too, sitting is the new smoking. And the reason why sitting is so detrimental to health is that we slouch, we lean forward, and we're not really in a proper position. Something that's really important is called your hip flexors, and it pulls your thigh up to your chest. When you sit all the time, your hip flexors get weak, they get tight, and then what happens is that they don't release, and then you start to have hip issues, back issues, groin issues. So if you catch yourself sitting, my best recommendation during commercial breaks, if you're watching TV, get up, do some squats, move around the house, stand, do a quick stretch. If you do have to sit, whether it's driving or whether it's you're eating dinner, as much as possible, practice good posture. Very, very, very important too that you try to change positions as much as possible. So that means standing, sitting, tilting to the side, doing a quick stretch, because if we stay in that position, your body automatically wants to go forward into that position, or you want to try to get yourself out of it to prevent back issues and back pain. Now, what happened when I had the herniated disc that I mentioned was that I was trying to lift with the person on the left versus the person on the right. Now, with the person on the left, as much as possible, we want to keep the spine in a straight position. So a straight line from the ear, shoulder to the hips. And that's how you keep your back safe. What I tried to do is that I tried to lift, it was like 260 pounds, and I tried to deadlift with a rounded spine. So I pulled up and I immediately heard the pop. And the reason why the posture on the left is incorrect is that that spine is in that upside down U position. We never want to be in that position. As much as possible, stomach has to be sucked in. We're using our legs to lift and your spine is upright. So when you think about the back muscles don't really do lifting, if that makes any sense. The back muscles stabilize your trunk so that your legs can do the lifting. So that's why they tell you to use your knees or use your legs to lift, is that your legs are the primary mover, but your core, your stomach, your lower back muscles isolate the spine so that you don't round forward. So if you are moving, you're doing yard work, you're doing gardening, you're picking things up off the ground, as much as possible, squat down. Maintain an upright spine. Keep your chest lifted. Pick something up as opposed to rounding forward. Now, we talked about, the benefits of the back. We talked about why it's important. I hope that I shared a lot of good information with you. From here, we're going to transition into standing up and exercising. I'm going to move my chair back, and then I'm going to recommend that you use a chair that doesn't have wheels. So I can give you a couple seconds to grab that now. Make sure it's a stationary chair, because we're going to do some exercises standing, and then we can use a chair for balance and stability if needed. Now, I'm going to move back a little bit. And keep in mind, everyone, this chair has wheels, but for today, just pretend that it doesn't have any wheels. I'll give you a couple seconds, grab your chair, and then we're going to go ahead and get started with the exercise. So I'll give you about 20, 30 seconds. Now, as I said, everyone, with proper alignment, we want to think about your ear, shoulder, hip, knee, ankle in one straight line. So as much as possible, straight line, standing up tall the whole time. Now we're going to do a stretch to extend the spine backwards, because the forward motion, this is so easy to do. We don't do a back motion or a back bend as very often. Now what I want you to do is I want you to take both hands, press it against your lower back. I want you to lock out the knees, shift the weight to your heels. I want you to squeeze the glutes and then look up to the ceiling. Take a deep breath, inhale, chin up, chest up, grow your spine. And then you're going to look back, lean back, fall back, squeeze your glutes, and see if you can turn your body into an upside down U for 3, 2, 1. Inhale, bring it back up. Everyone, we're going to do 4 more. Keep in mind, go as far back as you can. Inhale, chin up, chest up, hold it there. And then squeeze your glutes, look back, lean back. You want to engage your back muscles, arch your spine. Keep your chest lifted for 3, 2, 1. Inhale, bring it back up. Same thing, another deep breath. Can you stand up as tall as you can? Lock out your knees, shift the weight to your heels. And then look back, lean back, fall back, squeeze your glutes for 3, 2, 1. And then inhale, bring it back up. We're going to do 2 more. Another deep breath. Exhale, look back, lean back, fall back, squeeze your glutes, keep your chest lifted. Inhale, bring it back up, and then one more time, another deep breath. Hold at the top, keep your chest lifted, and then look back, lean back, squeeze your glutes, feel a deep stretch on the front side of your body for 3, 2, 1, and bring it back up. Now, everyone, if you release, you might feel some tension in your back, but you'll notice you feel so much taller because we're learning how to engage your glutes. We're learning how to engage your spine and then lean back and then stretch out your whole front side of your body. Now, we're going to do the opposite of what we did. We're going to do a forward fold. We're going to stretch out the back side of your body and engage the front. Place your hands on your hips. Take a deep breath. Inhale. Grow your spine. Chin up, chest up. From here, we're going to fold in half. See if you can lean forward towards your toes. Keep your knees locked. You're going to feel a deep stretch in the back of your legs. See if you can hold it there. Try to relax into the stretch. Take another deep breath. Stand up tall. Chin up, chest up. And then same thing. Lean forward. Shift the weight to your toes. Feel a deep stretch in the back of your leg. When you exhale, try to relax your legs. Feel a deep stretch. Inhale, bring it back up. Everyone, we're going to do 3 more. Deep breath. Stand up as tall as you can. Grow the spine. And then lean forward. Feel a deep stretch in your back. Now, you want to make sure you maintain a level or a straight spine. So from your ear all the way down to your hip, everything is straight and you're pulling your shoulder blades back. Inhale, bring it back up. Same thing, grow the spine, stand up as tall as you can, create length, and then maintain that length as you lean forward. Feel a deep stretch, hinge at the hip. Deep breath, inhale, chin up, chest up. And then same thing, exhale, lean forward. Feel a deep stretch. Try to keep your knees locked for 3, 2, 1, and then inhale, stand up tall. Now, everyone, if you shake it out, move around, you'll notice that you feel taller and you notice that the back of your legs feel more loose and you'll notice that your lower back muscles feel so much better too. Now, we're going to transition into a hip stretch. What we're going to do is that we're going to bring your knee up. So if you have the balance and stability, you can use both hands to pull on your knee. If you feel a little bit wobbly, you can always use one hand on your knee, the other hand on your chair. Now, if pulling on one leg is too difficult, you can always place your leg on the chair and then gently lean forward and pull. Now, what you'll notice is that you'll feel a deep stretch in your hip. If you're pulling your knee like this, can you balance and stabilize on one leg and pull? Keep in mind, if it's a little bit too much, use your chair for assistance and then gently pull the knee up. You'll feel a deep stretch in your hip. If you keep your spine upright, you can gently lean forward and you'll feel a deep stretch, opening up your glute and opening up the back of your leg. Make sure you continue to breathe. If you feel like you're holding your breath, just breathe and relax into the stretch. It's much easier to open your body when you're relaxed and you're breathing. Now we'll release. You can shake it out a little bit. Switch other side. You can put your leg on the chair. You can lift your leg up if you feel like you're up for it. So just do what works best for you. Just know this exercise stretching practice is a totally individual perspective. So you can do as much as you can. You don't have to do as much as me. Continue to stretch. You can pull your knee up. Make sure you maintain an upright spine. Continue to pull. Continue to breathe for 3, 2, 1, and release. Now you'll feel the front of your thighs, your hips. Everything should feel a little bit more loose and more mobile. Now I'm going to move back a little bit more so you can see me. I'm going to slide the chair off to the side. What I'm going to do is that I'm going to place my heel on the ground and I'm going to lean my weight forward to stretch the back of your leg. See if you can point your toes up, keep your stomach sucked in, and then gently lean forward. With your spine, if you notice yourself rounding like this, maintain an upright spine, suck in your stomach, keep your chest lifted. Gently lean forward with a straight spine from your ear all the way down to your hip. You can place your hands on your hips because if we reach for your toe, you notice you're going to round your spine. So we don't want to round. Hands on your hips, push your hips back, maintain a straight spine. Feel a deep stretch. Now, just pointing the toes up will deepen the stretch in the back of your legs. So just continue to breathe. With every exhale, try to relax the back of your leg as you lean forward. Try to suck in the stomach, and with every inhale, can you straighten out your spine? And try to maintain an upright spine as you push your hips back. 3, 2, 1. Switch other side, step your foot out. Same thing, maintain an upright spine and then push your hips back. Your back leg is slightly bent. Your front knee is straight and you're pointing your toes up to your face. Make sure you maintain an upright spine. I like to drill that in just because we tend to forget sometimes. Make sure you suck in your stomach, keep your chest lifted, and pull your shoulder blades back. Gently lean forward if you can maintain a straight spine. And if you get to a point where you can't move anymore, just hold it there and breathe for 3, 2, 1, and then stand up tall. Now, everyone, if you walk around a little bit, you'll notice you feel a little bit more loose, a little bit more limber, and that's what we want when we stretch. Now, we're going to transition into the chair, and I'm going to adjust my camera so you can see me as I'm sitting. Now, we're going to do some of the same stretches that we did standing, but when we do it seated, we'll still get a deep stretch, but we don't have to worry about maintaining balance on one leg, so this should be a little bit easier. So straight spine, ear, all the way down to your hip, straight line the whole time. Take both hands, pull on your knee, bring your knee to your chest. As you bring your knee to your chest, you want to grip your hands together, suck in your stomach, and then try to keep your sit bones, your glutes, on the chair. If you have the mobility, pull a little bit more. Try to relax this knee that you're pulling on, but then push your other foot into the ground as you pull. Continue to breathe in and out through your nose, maintain an upright spine, and pull. 3, 2, 1, and then exhale, release. Same thing, switch other side, pull on your knee. Make sure you're sitting up tall. You want to push the other foot down, and the knee that's bent, the knee that you're pulling on, try to relax that hip. Try to keep your spine upright as much as possible as you pull the knee to your chest. Now, the reason why you want to breathe is that breathing helps relax your body. So if you're starting to tighten and tense, see if you can slow your breathing down and gently pull and feel a deep stretch in that hip. Exhale, release. From here, we're going to take your ankle and we're going to see if we can place your ankle onto your other knee. Now, if this is all you can do today, you can hold it here. If you have the mobility, see if you can push your knee down, push your ankle down, maintain an upright spine, and then gently lean forward. And you're going to notice this hip will start to release and it'll start to feel kind of tight. Make sure you continue to breathe. Try to relax this side of your body. Keep your chest up and continue to breathe, gently lean forward. Now, one of the tricks I like to recommend is that if you're feeling lots of discomfort, you can back off a little bit, but also work on lengthening your exhales because when we exhale, that's how we relax your body. We're leaning forward and we're stretching and we're going to hold it there for 3, 2, 1, and then release. Switch other side, ankle on your knee. Sitting up tall, one hand on your knee, the other hand on your ankle. Gently lean forward. When we engage your abdominals, that actually helps release your lower back. So stomach is sucked in. Your chest is lifted. We're maintaining an upright position as we lean forward. If you notice your sit bones start to shift, see if you can push your sit bones completely flat as you lean forward. Continue to breathe for 3, 2, 1, and release. Now, everyone, we have one more stretch. What I want you to do is I want you to take one hand on your knee, take the other hand on the base of your chair. I want you to squeeze your knees together, press your heels into the ground. Don't let your knees or don't let your legs move. Take a deep breath. Inhale, maintain an upright spine. Now, exhale, turn, twist, look over your shoulder. See if you can use your hands as leverage to press into your knee and to hold the chair as you twist. Suck in your stomach. Don't let your lower body move. Try to look to the back wall. Try to move your chest at the same time. Stomach is sucked in and exhale, twist. Exhale, twist. Exhale, twist, and release. We'll do the same thing to the other side. Hand on your knee, the other hand on the base of your chair. Squeeze your knees together, press your heels into the ground. Take a deep breath. Inhale, chin up, chest up. And then exhale, turn and twist. Squeeze your knees together. Press your heels into the ground. Suck in your stomach, keep your chest lifted, and look to the back wall. Exhale, twist, and look. Exhale, twist for 3, 2, 1, and release. Now, everyone, take a deep breath in. Keep breathing. Hold your breath at the top. And then exhale for 6, 5, 4, 3, 2, and 1. So everyone, if you move around a little bit, your spine should feel much more loose. Your legs should feel much more loose. You should feel much more relaxed because when we stretch, we breathe, we work on relaxing the body. So stretching not only benefits the physical body, but makes you feel much more relaxed and makes you feel much more calm. So everyone, I'm going to go back into the presentation. And after that, I'll have some time for Q&A as well. Okay, so give me 1 second. So everyone, what we just did was stretching and breathing, which is essentially what yoga is. Personally, for me, I like to do a lot of yoga because I feel like that's what opens my back. For you, if you like weight training, if you like taking a circuit class, if you like stretching at home, I don't think there's one best exercise that works for anyone, but just know moving, staying active, stretching, moving your spine, moving your legs, activating your hips, all of those things are very important to keep your spine healthy. With stretching, I do it on a daily basis just because I know the more I stretch, the better I feel. If you want to start off maybe 2-3 days a week, seeing how you feel, I'm going to send out the handout, which has all these stretches that we worked on to you. It has instructions as well. So you can try doing that at home. You can try doing it with a friend. Just know doing something will make you feel so much better. Also, everyone, I know we all love walking. Personally, for me, I love to walk my dogs. I love, yeah, I know a lot of people don't like it to say it, but I love housework and I love yard work because I love building things. I love maintaining like a really nice backyard. So I think the more you can stay active, doesn't have to be structured, doesn't have to be stretching, but just moving will make you feel so much better. Now, I think after, a lot of people work with me, they're like, Kevin, like, I feel so much better. I want to maintain this. What do I need to do? What we're going to do now is that we're going to try to make a plan for you to be successful. So you have the information, we took this webinar, you took this class, you've seen all this great things that we can do with stretching. You have the motivation. I think everyone wants to be healthy. Everyone wants to take care of their bodies. But how can we change your behavior? How can we go from not stretching so much and being sedentary to being active? And the biggest thing is having a plan in place, because research shows that if you have a plan, that's going to help make it much more structured, and you're going to be much more successful in accomplishing and reaching your goal. So information isn't enough. Motivation isn't enough. We have to have some kind of plan in place to help us change your behavior and to be healthy. So I'm going to have you create a plan for the next 2 weeks so that you can help take care of your back. It can be anything from being aware of proper sitting position. It could be being aware of proper lifting techniques. It could be something like taking the stairs, walking, taking frequent stretch breaks. What's one thing that you learned today that really resonates with you that you want to add to this plan for the next 2 weeks? Keep in mind, everyone, just choose one thing, because if we choose too many things at once, we tend to kind of fall off the wagon because there's too many things we're trying to focus on. Just one thing. Personally, for me, if you like this presentation, if you like the stretches, try using the stretches handout and do that 3 to 4 times a week with your plan for the next 2 weeks. That's something basic. If you want to do something more like taking a yoga class, doing something that's a little bit easier, such as walking a little bit more often, you're more than welcome to choose that too. So
Hey,
we're
Kevin,
going to
real
use
quick.
smart.
Um, did you want to reshare your slides?
Oh, Mike, can you see that? Can you see my screen?
No, I think you need to reshare it.
Okay. Sorry, Mike. Right. You should see it right now.
Okay, there we go. And we can see your notes too, just so
Okay.
you know.
Thank you, Mike.
There we go.
So everyone, here's the slide that I was talking about, is the information, the motivation, and then the plan. So just make sure that you try to create a plan to take care of your body, to create a goal. Here's the kind of the things that I talked about on how we can choose a different plan. So like I said, everyone, it could be anything from taking stretch breaks, using the handout that I'm going to send to you, or using proper lifting techniques. So everyone, whatever you think you want to work on, go ahead and think about working on that. We're going to transition into SMART skills. This is very, very, very important, because SMART is an acronym that stands for setting a behavior goal, monitoring your progress, arranging your world for success, recruiting support, and then treating yourself. So setting a goal, what do you want to accomplish for the next 2 weeks? You want to be as specific as possible, just because a lot of people, we tend to just say, I want to exercise for 2 weeks. Well, being more specific knows that you can accomplish this goal and set this goal and reach this goal. So for instance, something like, I'm going to use the handout that Kevin sent out 3 times a week for 15 minutes, doing the exercises on the sheet at 8 o'clock in the morning. So being as specific as possible, we know whether or not we met that goal. So I want you to think about setting this goal, and you can write it on a piece of paper. You can write it as an email to yourself. So what goal will you set for the next 2 weeks? Next thing is, how would I monitor my goal? I'm a very old-fashioned person. I use a physical planner, and writing it down in your planner really helps. You can also write it into your phone. That's going to help too, on your phone calendar, or you can just write it on like a sticky note and just put it somewhere on your fridge so where you can see. Next thing is arranging your world for success, right? So personally for me, if I don't pack my yoga bag in my car, if I go home, I see my dogs, I see the couch, I'm probably going to lay down. If you think about arranging your world for success, you could do something like putting the handout next to the computer that I'm going to send out, or putting the handout on the computer, or even putting your walking shoes next to your desk so that you know you're going to walk. So the more often we can kind of change things around and arrange your world to help you be more conducive to your goal, that's going to help you out. Next thing is recruiting support. Who can you help, or who can help you reach this goal, and who can help support you? Something like your spouse, your kids, your friends, your neighbors, like letting them know, hey, like I'm going to start this goal to help exercise and help take care of my back. Can you help hold me accountable and support me? They can check in on you. You can help talk to them when you're not feeling so good about your goal. You can help ask for support when you need it. So who can help support you in reaching this goal? Studies show that when you recruit people and you bring people into your life, they're going to help you out and help encourage you. Last thing is treating yourself. How can you treat yourself? What are different things that you can do to reward yourself for good behavior? I know that when I was in elementary school, I got that gold star when I did my times tables correctly. I still remember like smiling, seeing that gold star. So how can you give yourself that gold star? Something like buying new exercise clothes, something like having a small treat at the end of dinner, something like buying new exercise shoes, or just treating yourself to something that you really want and that you can align this healthy behavior with this treat. So SMART is a SMART goal. Everyone really think about trying to apply this to this goal that we're going to create so that you can be much more successful in reaching this goal. So everyone, I'll give you a couple seconds. You can kind of look over the Smart Skills screen. You can kind of finish up your goal. Make sure you make it as specific as possible. Make sure you monitor your goal. Make sure you recruit yourself, and then make sure you reward yourself for healthy behavior. Now, I want you to think about if you were to achieve your goal, right? If you met this goal, we don't have back issues anymore. We feel so much better. We feel energized. We feel awake. We feel like relaxed, and we feel like we're more independent. How would your life be different 6 months from now? Would it be better? Would it be worse? How would you feel when you met this goal and you accomplished this goal and you feel so much better? So everyone, just know, as a trainer, I've been doing this for almost 13, going on 14 years. I've helped a lot of people. The biggest advice that I would give you is that everything counts, whether it's taking a small stretch break, going for a 5-minute walk, gardening, walking your dogs, even just doing something active with your spouse or with your friends, just getting up and moving and not being sedentary, not sitting, not doing something like this is the best advice I could give you. So just know we don't need to climb the top of the mountain right now. We can get to the mountain by taking small steps to take care of your health. And just know anytime, anywhere, you can take care of your health and you can feel so much better. So everyone, I'm going to stop sharing. We have about 4 minutes left. I can open up the Q&A and I can kind of see what's going on and how I can help you reach your goal. And Mike, if you want to help moderate too, you're more than welcome to.
Sure. There's a couple of questions about sciatica. Would this exercise help with sciatica?
Yes.
And is somebody has sciatica and gets leg cramps very easily, and is that a permanent injury?
Yeah, so with sciatica, it's probably due to this muscle called your piriformis, which is in the back of your hip, and it gets really tight. And doing the stretches, especially this stretch where you're putting your knee and you're leaning forward, will help open up the back of your leg so that the sciatic nerve doesn't get inflamed. So I'd recommend doing stretching. I recommend using a heating pad to relax that muscle to help get rid of sciatica. Sciatica isn't a permanent diagnosis, so you can help prevent it by stretching and opening up your hip. But it's not like a permanent diagnosis where you can't get rid of it. I think the more you can stretch, the more you can take care of your body, the better you'll feel.
Awesome, thanks. There's another couple of questions about the sacroiliac
Iliac joint soreness.
Iliac joint.
Yes.
Yeah. Couple of questions about soreness at that joint.
Yeah.
And somebody is asking, would that go away after a few months? Because they're already doing stretching and moderate active exercising.
Okay. So everyone, keep in mind, I'm not a profession where I can diagnose. I'm a personal trainer and I haven't met with you one-on-one. I recommend if you do have a primary care provider, going to see them, talking to your physical therapist, because they could do an MRI and they can see which muscle it is. They can do a test to see which muscle is injured and how to properly align you. But I recommend you definitely do want to see a physical therapist to do a more in-person diagnosis. But I would say yes, if you can think about stretching it, adding a heat pad, performing stretches where you feel a stretch but not a lot of pain, that's going to help you out a little bit more. And also everyone, certain stretches might help people, certain stretches might not. So just see what works best for you and see what feels good. And if it hurts a lot and if it causes a lot of pain, you want to avoid that too.
Great, thanks. There's a few questions about what materials we're going to make available. We're going to post this video out on our website on the health fair page at acera.org/healthfair about by midweek next week. And it sounds like Kevin, you're going to provide us with a worksheet. Are you also going to share your presentation?
I will send out the worksheet. Let me see if I'm able to send out the presentation. I just have to double check real fast, but I'll for sure send out the worksheet to you too, Mike.
It sounds like the worksheet will have probably the pertinent part that people are looking for anyway.
Correct. Yes.
Yeah. Okay, great. And then let's see. There's a question about are the stretches appropriate for people with osteoporosis?
Yeah, and I think I saw that question. So with osteoporosis, that's the bone density starting to get weaker just because of genetic issues, and especially in women, you start to lose muscle mass after menopause. I recommend doing weight-bearing things such as like walking, a little bit more weights, such as like doing squats, doing lunges, even doing water aerobics will help build muscle tone. Stretching will help open up your body. It can build some strength, but if you have osteoporosis, you definitely want to do a little bit more weight-bearing activities to build muscle mass and to build bone density too.
Thank you. There's one comment in here regarding the Silver and Fit program, and it's kind of regarding the availability of certain gyms. And we will have our Kaiser representative contact you about that and see if we can get you some help with that. And then I think we maybe have time for one more question. Somebody is asking if they have spinal stenosis and would these exercises help?
Yeah, and I saw that question. So I would say it's hard to, because that's more of a, I would say talk to your primary care physician and then talk to your physical therapist too, just because they would know your body a little bit more. And I couldn't give you that information just because we haven't met one-on-one. I think try the exercises and see how it feels. If it feels good, you can do a little bit more of it. But if it starts to hurt, we don't want to put the body in a painful position. Exercise and stretching should make you feel better, not make you feel more stiff. So just see how it feels, try a little bit, add a little bit on, and if it's too much, you can take a little bit off.
Okay. All right. Thank you so much, Kevin. That was amazing. You are an excellent instructor. Like I said, we're going to post this video out on our website early next week. And thanks again for being here with us.
Yeah. Mike, I'm going to send the presentation to you now. Everyone, it was a pleasure and honor to help you stretch and take care of your body. Please take care, enjoy the rest of your day, and enjoy this rest of this health fair too, okay?
Thanks so much, Kevin.
Okay.
And as soon as he sends that over, the worksheet over, we'll get that posted up on the Acera Health Fair webpage today. So at acera.org/healthfair.